Good day, I am Shalame Tudyo and I'm going to report about Wilson disease. Okay, so Wilson disease, it is a rare genetic disorder characterized by excess copper stored in various body tissues, particularly the liver, brain, and corneas of the eyes. So the disease is progressive and left untreated, it may cause liver or hepatic disease, central nervous system dysfunction, and may lead to death. It was discovered by Samuel Alexander Kinnear Wilson, 1878 to 1973. Okay, so Wilson disease or WD is an autosomal recessive neurometabolic disorder due to mutation in ATP7B gene on chromosome 13. So this leads to defective copper metabolism resulting in excessive copper deposition in several organs primarily involving liver and brain. Although Friedrich in 1861 first described a child having movement disorder with his autopsy findings showing liver cirrhosis. And then it was Zach Wilson who published a comprehensive description of the clinical and pathological features of progressive lenticular degeneration in 1912. Nearly 4 decades later, dimercaprol was introduced in its treatment. So the pathogenesis, since copper is toxic in free form, it is transported in a bound form ceruloplasmin from hepatic cells to several tissues, and excess copper is excreted in bile. So the ATP7B protein is involved in transport of copper for synthesis of copper-bound ceruloplasmin from apoceruloplasmin and biliary excretion of excess copper from hepatocytes. So the word hepatocytes means the liver cells. So the mutation in the ATP7B gene and chromosome 13 results in failure of copper transport and abnormal accumulation of copper in hepatocytes, and spillage of excess non-ceruloplasmin copper from liver cells to systemic circulation, leading to its accumulation in several organs including the brain. So excess free copper in the liver, brain, and other organs may either cause a direct toxic damage or result in failure of the antioxidant defense system, leading to increased oxidative stress and free radical damage to local tissue. Okay, so this is the anatomy and physiology of the organs involved in Wilson disease. So, as you can see, in the CNS or the central nervous system, involvement up to 70% ang ma-affect. So, primarily involves basal ganglia. So, it is a part of the brain, midbrain. So, it will cause Parkinsonism and dystonia. This is the most common. And the ataxia chorea and seizures, psychiatric features, cognitive deterioration. So, Wilson disease will affect the brain, especially in the basal ganglia part. And next is the liver and hematological. So 10 to 35% that it will affect. So it will have acute and fulminant hepatitis, chronic hepatitis, cirrhosis, COMS, negative hemolytic anemia. And then next is the musculoskeletal 2 to 14% that will affect, and it will cause polyarthritis, low back pain, osteomalacia, osteoporosis, spontaneous fracture, and rickets. And in the eye, up to 100%. So these symptoms or the organ involved is very clear, or it will be seen right after. So the KF ring or the Kaiser-Fleischer ring, 97 to 100%, neurological WD or the Wilson disease, and 14 to 87% of hepatic WD, and up to 60% of pre-symptomatic cases. So ang KF, it is the most common, and and the sunflower cataract is rare. So next is the heart and autonomic nervous system up to 10 to 40%. It will affect the ECG abnormalities, cardiomyopathy, parasympathetic and or sympathetic dysfunction. Next is the kidney. Up to 10% that will affect. So it will cause renal tubular dysfunction, nephrocalcinosis, nephrolitis, vitamin D resistant, and lastly rickets. Okay, so this is the eye, the Kaiser-Fleischer rings, the cardiac, the renal, proximal renal tubular dysfunction, liver, hepatomegaly or enlargement of the liver, jaundice, acute hepatitis, fulminant hepatic failure, portal hypertension, bleeding, varices, and cirrhosis. And in bone, arthritis or rickets. And I said this already, the central nervous system, deterioration in school performance, behavioral changes in coordination, handwriting deteriorates, resting and intention tremors, dystonia, dysarthria, excessive salivation, mask-like faces, and dysphagia. Okay, so this is the Kaiser-Fleischer ring. So it will seen on the corneas of the eyes. Now the deposits of copper cements corneal membrane. So this the deposit of excess copper goes in the cornea, and it calls Kaiser-Fleischer ring. So diagnosing this Wilson disease, it will have several diagnostic testing. So one of those are the serum seroplasmin level, 24-hour urinary copper, MRI of brain, ophthalmologic examination, liver biopsy, and genetic testing. Okay, so in serum seroplasmin level, typically decrease in patients with neurologic Wilson disease, may be in the low normal range in 50% of patients with active Wilson's liver disease. So next is the 24-hour urinary copper testing, more than 0.6 micrometer 24 hours to 38 micrometer per 24 hours. Measuring 24-hour urinary copper excretion while giving D-penicillamine is useful confirmatory test. More than 25 macrometer per 24 hours is considered diagnostic of Wilson disease. Next is the MRI of brain. So MRI is the most important diagnostic tool in patients with neurological presentation. Almost all patients show an MRI abnormality. So non-specific changes in the brain such as diffuse brain atrophy and focal abnormalities. So the brain is the most important to diagnose Wilson disease. Next is the liver biopsy. So method of choice for diagnosis of WD or the Wilson disease: hepatic copper content of 25 grams, 40 mole per grams, dry weigh in confirmative of WD, sensitivity 83.3%, specificity 98.6. So liver biopsy is one of the diagnostic tests. And the next is genetic testing. Developments of new techniques in genetic and molecular biology have provided useful tools in the diagnosis in recent years. So PCR is to detect mutation, and H1069Q mutation is the most common mutation among the WD. So WD is a genetic hereditary disease. So we need genetic testing to prove or diagnose that the person has a Wilson disease. So the medical management, treatment. With proper therapy, disease progress can be halted and oftentimes symptoms can be improved. Treatment is aimed at removing excess accumulated copper, best accomplished by copper chelation therapy using penicillamine, triantine ammonium tetrahydromolybdate, and preventing its reaccumulation, accomplished by zinc ingestion and omitting copper-rich dietary components. So the first thing to do is to remove excess accumulated copper, and after that, we're going to have a preventing its reaccumulation by accomplish zinc ingestion and omitting copper-rich dietary components. So treatment for Wilson disease is a lifelong process. Treatment should be given to all affected individuals even if they are asymptomatic. So there are persons who are asymptomatic, but they also have the rights to have treatment. So the penicillamine, no, drug of choice, the dose given must be sufficient to produce coprophyresis, and most patients require 1.5 per gram per day, range 1 to 4 gram. So the dose can be reduced once the disease is remission, but treatment must continue for life, even through pregnancy. So even though we have the treatment, it is a long process. It will not deteriorate in that time, but it is a lifelong process. So care must be taken to ensure that the reaccumulation of copper does not occur. So abrupt discontinuation of treatment must be avoided because this may precipitate acute liver failure. So if you will stop the treatment, no, it will lead to precipitate acute liver failure. So do not abruptly discontinue taking the drugs needed. Next is the zinc. Acts by blocking the absorption of copper in the intestinal tract. This action both depletes accumulated copper and prevents its reaccumulation. So zinc is one of the treatment of Wilson disease. And next is the liver transplantation. It may require in patients with severe hepatitis or liver failure. So if the Wilson disease will not taken action immediately, no, it may require a liver transplantation because due to severe hepatitis or liver failure. So the value of liver transplantation in severe neurological Wilson's disease is unclear. So there are saying that some poet says that eyes are the window to the soul. But the doctor says that eyes are the window to the diagnosis of various diseases, especially like Wilson's disease. That's all. Thank you.